In the area of healthcare, the most important thing we can do is repeal Obamacare, because Obamacare sucked the oxygen out of the room for all sorts of innovations and reforms that were underway at the state level. Unless we can get the big foot of Obamacare out of healthcare, nothing else we do is going to work well. Second thing that needs to be done is Medicaid and Medicare reform. And these are huge programs. They're half of all healthcare spending in the United States. So you can't reform half of it and then leave the other half dysfunctional.
Well, there is a worldwide movement towards privatization, and among the reasons for it is that people want more choice themselves rather than letting the government choose things for them. In addition, private provision of services is often much more efficient. It not only matches better what people want, but it provides the services at lower costs. So those are the two major reasons why around the world, but particularly in the United States, we're moving more and more towards privatization.
Medicaid and Medicare drive up costs, destroy incentives to be better consumers. Just in a lot of ways, they pervert the entire system.
And we believe that if you're paying for something yourself, you have more control. If a third party is paying for it, such as the government, then you have very little control at all. And so the government dominates and the citizen is put to the side.
An economist looks at the world and says, why are people behaving in a certain way? What are their incentives? And if we get the incentives right, then we're going to get the behavior right. So how do we change incentives? In healthcare, most people rely on insurers for all of their healthcare. So the insurance company pays for it. So as a result, you never ask for the price. And you don't even say, well, do I really need these tests or do I really need this treatment? If it's paid for by the insurance company, sure, I'll do it anyway. And if the insurance company is covering the cost of drugs, things like that, I'll just demand all the drugs that I could possibly use. And if I can't use them, I'll give them to my relatives and let them use them. So we have a system that rewards excessive utilization of healthcare services. And in an environment like that, the providers, doctors and hospitals and even insurance companies, they have no idea what the real price of these products and services is either. So, everybody's kind of working in Plato's cave, where all we're doing is looking at the shadows on the wall. We don't know what the real price is, what the real cost is, what our competitors are charging, because it doesn't matter, because prices are fiction in healthcare. Fix that, and then you can transform the entire healthcare system.